Good morning. This is All India Radio, Kohima. The morning news are read by Jonas Yantan. Prime Minister Narendra Modi yesterday reviewed the work being done by the armed forces in combating COVID-19, including the efforts to enhance medical capacities and utilizing human resources. The Chief of Defence Staff, CDS, General Bipin Rawat, called on Modi and they reviewed the preparations and operations being undertaken by the armed forces to deal with the pandemic. The Chief of Defence Staff briefed the Prime Minister that all medical personnel from armed forces who have retired or taken premature retirement in the last 2 years are being recalled to work in COVID facilities within the proximity of their present place of residence. Other medical officers who retired earlier have also been requested to make their services available for consultation through medical emergency helplines. The Prime Minister also discussed with the CDS that Kendriya and Rajya Sainik welfare boards and officers posted in various headquarters in veterans' cells may be instructed to coordinate the services of veterans to extend the reach to the maximum extent possible, including in remote areas. Nagaland government has been given a 45-day time frame to reconstitute a committee with a new chairman to study the implementation of the Nagaland Liquor Total Prohibition NLTP Act 1989 and revamp it, if required, and table a report at the earliest. The decision was unanimously agreed upon during a consultative meeting of Advisor, Excise, Sericulture and Minority Affairs, Zalio Rio, along with Commissioner and Secretary, Excise Department, departmental officers and the Dimapur Naga Students' Union officials yesterday against the backdrop of the 20-day ultimatum to the state government made by the student body. During the meeting, the student body was apprised of the existence of the committee constituted by the Cabinet on November 2018 to study the issues related to implementation of the NLTP Act 1989, which had already held 2 rounds of meetings on December 7, 2018 and March 7, 2019 on the issue. The advisor reiterated that ample time should be given to the government as the process involves a lot of consensus building and dialogue involving all stakeholders. Kripa Foundation Nagaland has urged the state government to appoint an HIV and AIDS ombudsman immediately. In a letter to the Law and Justice Principal Secretary, Kripa Foundation Nagaland stated that the timeline for appointing ombudsman was long overdue and hence the issue required urgent attention and necessary action. It said a government should appoint ombudsman who is a retired district and session judge or anyone with minimum 10 years of working experience having extensive knowledge in matters relating to public health or health delivery system, or a qualified healthcare provider who is a physician or a person working in NGO with similar experience and knowledge within 180 days from the date of notification. The Kripa Foundation Nagaland further appealed the department to give an open advertisement immediately to fast-track the appointment of an ombudsman under the Nagaland HIV and AIDS Ombudsman and Legal Proceeding Rules 2019. Dimapur District Excise personnel, while manning the new field check gate, seized 436 cases of assorted Indian-made foreign liquor, IMFL, from a truck on Sunday night. Superintendent of Excise and Prohibition, T. Arilong Longkama, stated that based on specific information, the excise personnel intercepted a truck and recovered the assorted IMFL concealed under the blocks of bricks. The consignment, which was bound for Imphal, originated at 7th Mile, Govt. The accused, K. Shyam Chandra Singh, 41 years, resident of Bishnupur, Manipur, has been arrested. The seized items have been deposited in the district excise Malkhana, and further the case is presently under investigation. As the number of COVID cases are on the rise again, we appeal to our listeners not to lower the guard, follow all the precautions and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. With that, we come to the end of the morning news. Have a nice day.